In some parts of the country, masking in healthcare settings is still mandatory, but in most provinces, it's not or won't be for long. While many welcome the shift, human rights groups are concerned, and some are asking this question.
Why do you feel like now is the appropriate time?
BC's chief medical officer says mandatory masking in hospitals is being dropped based on COVID levels in the community.
As we've come through the respiratory season, we are seeing much less spread of virus. There's much less community illness.
Quebec and Ontario are leaving masking rules up to individual hospitals. Dr. Alain Weisman is responsible for infection prevention and control at UHN, Canada's largest research hospital.
Our primary objective is always to keep patients safe.
He says masking will remain in all traditionally high-risk areas. Patients entering emergency rooms may still need to mask up, but fewer people may be wearing them in hospital lobbies, hallways, and elevators.
The risk to patients has dramatically changed over the last few years because of vaccination, because of previous infection, because of therapeutics. Patients are not as high risk of acquiring COVID and having bad outcomes with it as they were in the past.
Data show since January, the number of COVID-19 deaths in Canada has been steadily decreasing. The virus killed 113 Canadians during the last week of March.
Just need to grab a mask there, sir, and good to go.
PEI plans to drop mandatory masking next week, but health officials say they've helped.
If we have a large outbreak of influenza or RSV or COVID in the future, as we get into the winter seasons, I think it would be quite reasonable to bring back masking in hospitals in certain areas.
And experts insist no one is saying Canadians shouldn't wear a mask when going into a hospital or other healthcare setting. They're only saying it's not mandatory. Christine Burak, CBC News, Toronto.